Hi, my name is Maggie Burton, and this is my skills video for pregnancy education for BSN 346. I'm in section 5. My name is Maggie. I'm going to be your nurse today, and we're going to go ahead and talk about some education topics for your pregnancy. So, a couple of things to avoid for food. You're going to want to avoid raw or uncooked meats like sushi, rare steaks, poultry that's not cooked all the way, because this can cause toxoplasmosis, which is a parasite infection that can lead to neurological damage of the fetus, salmonella or listeria, which are bacterial infections that can lead to preterm labor or fetal complications. Something else to avoid is unpasteurized dairy products like raw milk and soft cheeses, because this can cause listeria, again, a bacterial infection, or foodborne illness, which is not great for mom or baby. And then the last thing of foods to avoid is deli meats, unless they're fully cooked through, because these can cause fetal complications. They can the bacteria can cross the placenta and cause fetal complications. Next, we're going to talk about some medications. So some things that are safe are acetaminophen, antacids, cold and allergy meds like Claritin and Zyrtec are okay to take while pregnant. These something else to take while pregnant, folic acid. This helps to reduce the neural tube defects and supports fetal brain development. Iron, which prevents maternal anemia and supports increased blood volume. Since you have a baby, more blood volume in your body. Some things to avoid are NSAIDs. This is not good for pregnancy. It can increase the risk of miscarriage. It's also a potential to decrease the amniotic fluid, which is the sac that baby's being kept in, like your water. Avoid decongestants, because these can constrict the blood vessels and it can potentially restrict the blood flow to the placenta. Avoid herbal supplements like St. John's wort. This can cause uterine contractions. Ginseng, which is a more common herbal remedy that people like to use, and it's linked to developmental abnormalities, so it's something to avoid. And then supplements to avoid: vitamin A. High doses are linked to birth defects like cleft palate and cardiac malformations, and then excessive vitamin E amounts can increase abdominal pain and the pre-rupture of your membranes, which is like your water. And then now we're going to talk about environments that need to be avoided while you are pregnant. So tobacco, secondhand smoke exposure. This is a big one because it can cause fetal growth restriction, congenital abnormalities, and it can reduce or increase the chances of the baby having SIDS, sudden infant death syndrome. We also want to avoid pesticides. These are lawn and garden chemicals. They can cause neurodevelopment effects, lower IQ, cognitive delays in the fetus. It can cause preterm birth and low birth weight, as well as congenital malformations. Household cleaning chemicals like bleach and ammonia are also some things that you want to avoid, because this can cause respiratory irritation, and toxic effects of these chemicals can increase the risk of miscarriage. Alcohol and tobacco and other substances we definitely want to avoid. Drinking alcohol, any amount, can increase the risk of fetal alcohol syndrome, which comes with cognitive and behavioral impairments. Miscarriage increases the likelihood of miscarriage and stillbirth. Tobacco, this causes reduced oxygen because the nicotine restricts the blood vessels, so therefore you're reducing oxygen to the baby and reducing nutrient delivery to the baby, which is really important for them and their growth. It can also cause low birth weight, placental issues, and increase the risk of SIDS as well. And then lastly, substances. These can cause neurodevelopmental delays because THC crosses through the placenta, and this can alter fetal brain development. Using substances while you're pregnant can also increase the chances for low birth weight, preterm weight, stillbirth, those kinds of things. So next we're going to talk about travel precautions. The safest time to travel when you're pregnant is during the second trimester. This is when the uterus is still small enough to reduce physical discomfort, risk of the miscarriage is lower, and energy levels are usually higher. The first semester, there's a higher risk of miscarriage. There's limited access to prenatal care in cases of emergencies. And then in the third, there's an increased risk for preterm labor, greater discomfort, and also airlines sometimes will have restrictions on like the ability to travel for people in their third trimester. So when you are going to travel when you're pregnant, you want to make sure that you're obtaining clearance from your provider. You want to carry a copy of your records, insurance, and medical coverage just to have it in case you do end up needing to go receive care. You want to make sure you're bringing your prenatal vitamins, your snacks, a water bottle to increase hydration, and then compression socks to reduce the swelling of your legs. And when you wear compression socks, it helps to promote blood flow to your limbs and throughout your body. You want to avoid traveling to places that have Zika and malaria prevalent. These are linked to microcephaly, and it can increase the risk of miscarriage, stillbirth, low birth weight. We also want to avoid high altitude because reduce oxygen levels, and they can increase the risk of preterm labor. So that's not good, and we want to avoid that, as well as traveling to remote areas that have limited access to healthcare. It's also very important to talk to your provider about when it's not safe to travel. If you have any conditions like preeclampsia, placental previa, placental abruption, history of preterm labor in previous pregnancies, or multiple gestation in the third trimester, then it's not a good idea to travel. So, another thing to be concerned about, or just to be aware of, is the risk of sitting for long periods. This increases the risk for deep vein thrombosis, also known as DVT, which is blood clots. Pregnancy and the elevated blood volumes, as well as hormonal changes, can make it more likely to experience a deep vein thrombosis, a blood clot, as well as swelling and discomfort and from sitting for long periods of time on an airplane. Next, we're going to talk about dental, and the best time to receive dental is usually in the second trimester, which is weeks 14 to 28. It's the safest period of pregnancy for routine dental and a lower risk of miscarriage during that time. Safe dental procedures are routine cleanings and exams, fillings and crowns. Lidocaine and epinephrine can be used in small doses for these things. We do want to avoid cosmetology work and teeth whitening, though, unless medically necessary. X-rays are safe just because modern X-rays these days use very low radiation, but you want to make sure you're using protective measures like a lead apron to avoid exposure to the fetus. So some common issues with during pregnancy is gingivitis. This is because there's a lot of hormonal changes going on in your body. It increases blood flow to the gums. It makes them more sensitive, red, swollen, and even sometimes bleeding. This can lead to periodontal disease if untreated, so you want to make sure that you are practicing good oral hygiene while you're pregnant and doing those routine exams with your dentist just to make sure everything is going well. And then the last thing to look out for, something that's more common in pregnant women, are called pregnancy tumors. And due to the hormonal changes, these can cause an overgrowth of gum tissue. They're small, red, swollen, and bleeding growths on the gums, and they usually shrink after pregnancy, but they can be removed if they cause discomfort. So just something to think about and keep your eyes on. And this is just a little bit of education for you going through your pregnancy, and we're here to help you if you have any questions. And thank you for your time.